Well, Cushing syndrome occurs when your body has too much of the hormone cortisol over time. This can result from taking oral corticosteroid medication, or your body might produce too much cortisol. Too much cortisol can cause some of the hallmark signs of Cushing syndrome: a fatty hump between your shoulders, a rounded face, and pink or purple stretch marks on your skin. Cushing syndrome can also result in high blood pressure, bone loss, and on occasion type 2 diabetes. Treatments for Cushing syndrome can return your body's cortisol levels to normal and improve your symptoms. The earlier treatment begins, the better your chances for a recovery. Earlier on this channel, I have already uploaded a short video about Cushing syndrome. I hope you have already seen it. And today I'm going to present this illness in detail. Well, first of all, let me tell you the symptoms. The signs and symptoms of Cushing syndrome can vary depending on the levels of excess cortisol. Common signs and symptoms of Cushing syndrome are weight gain and fatty tissue deposits, particularly around the midsection and upper back, in the face, that is known as moon face, and between the shoulders, that is known as buffalo hump. Pink or purple stretch marks, that is stria, on the skin of the abdomen, thighs, breasts, and arms. Thinning, fragile skin that bruises easily, slow healing of cuts, insect bites, and infections. Acne. Signs and symptoms a woman with Cushing syndrome may experience: thicker or more visible body and facial hair, that is hirsutism, irregular or absent menstrual periods. Signs and symptoms men with Cushing syndrome may experience: decreased sex drive, decreased fertility, erectile dysfunction. And there are some other possible signs and symptoms of Cushing syndrome. Those are severe fatigue, muscle weakness, depression, anxiety, and irritability, loss of emotional control, cognitive difficulties, new or worsened high blood pressure, headache, infections, skin darkening, bone loss leading to fractures over time. In children, impaired growth can take place. You should contact your doctor if you have symptoms that suggest Cushing syndrome, especially if you are taking corticosteroid medication to treat a condition such as asthma, arthritis, or inflammatory bowel disease. Now I'll tell you the causes. Too much of the hormone cortisol in your body causes Cushing syndrome. Cortisol, which is produced in the adrenal glands, plays a variety of roles in your body. For example, cortisol helps regulate your blood pressure, reduces inflammation, and keeps your heart and blood vessels functioning normally. Cortisol helps your body respond to stress. It also regulates the way your body converts proteins, carbohydrates, and fats in your diet into energy. The role of corticosteroid medication, now I'll tell you the two types of Cushing syndrome. The first is exogenous Cushing syndrome. Well, Cushing syndrome can develop from taking oral corticosteroid medication such as prednisolone in high doses over time. Oral corticosteroids may be necessary to treat inflammatory diseases such as rheumatoid arthritis, lupus, and asthma. They may also be used to prevent your body from rejecting a transplanted organ. It is also possible to develop Cushing syndrome from injectable corticosteroids, for example, repeated injections for joint pain, bursitis, and back pain. Inhaled steroids medication for asthma and steroid skin creams used for skin disorders such as eczema are generally less likely to cause Cushing syndrome than are oral corticosteroids. But in some individuals, these medications may cause Cushing syndrome, especially if taken in high doses. Then I'll tell you about the endogenous Cushing syndrome. Your body's own overproduction of cortisol. And the condition can be due to your body producing either too much cortisol or too much adrenocorticotropic hormone, that is ACTH, which regulates cortisol production. In these cases, Cushing syndrome may be related to a pituitary gland tumor, that is pituitary adenoma, a non-cancerous, benign tumor of the pituitary gland located at the base of the brain produces an excess amount of ACTH, which in turn stimulates the adrenal glands to make more cortisol. When this form of the syndrome develops, it is called Cushing disease. It occurs much more often in women and is the most common form of endogenous Cushing syndrome. Then there could be an ACTH secreting tumor, rarely a tumor that develops in an organ that normally does not produce ACTH, will begin to secrete this hormone in excess. These tumors, which can be non-cancerous, benign, or cancerous, malignant, are usually found in the lungs, pancreas, thyroid, or thymus gland. Then there could be a primary adrenal gland disease. Disorders of the adrenal glands can cause them to produce too much cortisol. The most common is a non-cancerous tumor of the adrenal cortex called an adrenal adenoma, but only a small fraction of adrenal adenomas produce too much cortisol. Cancerous tumors of the adrenal cortex are rare, but they can cause Cushing syndrome as well. Occasionally, benign nodular enlargement of both adrenal glands can result in Cushing syndrome. Then there could be a familial Cushing syndrome. Rarely people inherit a tendency to develop tumors on one or more of their endocrine glands, affecting cortisol levels and causing Cushing syndrome. Now I'll tell you about some complications. Without treatment, complications of Cushing syndrome may include bone loss, that is osteoporosis, which can result in unusual bone fractures such as rib fractures and fracture of the bones in the feet. Well, on this channel I have already uploaded a detailed video about osteoporosis. That is very informative video. You can see that video. Okay. Also it can cause high blood pressure, that is hypertension, type 2 diabetes, frequent or unusual infections, loss of muscle mass and strength. Okay, these were the complications. Now I'll tell you about the diagnosis of Cushing syndrome. Well, taking oral glucocorticoid medication is the most common cause of Cushing syndrome. Your doctor can review all your medications, pills, injections, creams and inhalers, to determine if you are taking medication that can cause the disorder. If you are, you probably won't need other tests. Cushing syndrome from endogenous cortisol production can be difficult to diagnose because other conditions have similar signs and symptoms. Diagnosing Cushing syndrome can be a long and extensive process. You will likely need to see a doctor who specializes in hormonal disorders, endocrinologist. Okay, your doctor will conduct a physical exam and look for indications of Cushing syndrome, such as a rounding of the face, a pad of fatty tissue between the shoulders and neck, and thin skin with bruises and stretched mouths. If you haven't been using a corticosteroid medication, these diagnostic tests, which I am going to tell you, may help pinpoint the cause. The first test is urine and blood test. These tests measure hormone levels and show whether your body is producing excessive cortisol. For the urine test, you may be asked to collect your urine over a 24-hour period. Urine and blood samples will be sent to a laboratory to be analyzed. Your doctor might also recommend other specialized tests that involve measuring cortisol levels before and after using hormone medication to stimulate or suppress cortisol. Okay. Then there is another test, that is saliva test. Cortisol levels normally rise and fall throughout the day. In people without Cushing syndrome, levels of cortisol drop significantly in the evening. By analyzing cortisol levels from a small sample of saliva collected late at night, doctor can see if cortisol levels are too high. Imaging tests. CT or MRI scan can provide images of your pituitary and adrenal glands to detect abnormalities such as tumors. Petrosal sinus sampling. This test can help determine whether the cause of Cushing syndrome is rooted in the pituitary or somewhere else. For the test, blood samples are taken from the veins that drain the pituitary gland. These are known as petrosal sinuses. A thin tube is inserted into your upper thigh or groin area while you are sedated and is threaded to the petrosal sinuses. Levels of ACTH are measured from the petrosal sinuses and from a blood sample taken from the forearm. If the ACTH level is higher in sinus sample, the problem stems from the pituitary. If the ACTH levels are similar between the sinuses and forearm samples, the root of the problem lies outside of the pituitary gland. Okay. These tests help your doctor diagnose Cushing syndrome, and they may help rule out other medical conditions such as polycystic ovary syndrome, that is a hormone disorder in a woman with enlarged ovaries. On this channel, I have already uploaded a video about polycystic ovary syndrome. That is a detailed video. You can see that video. Okay. Depression, eating disorder, and alcoholism also can partially mimic Cushing syndrome. And now I will tell you about the treatment. Well, treatment for Cushing syndrome are designed to lower the high level of cortisol in your body. The best treatment for you depends on the cause of the syndrome. Options for treatment include reducing corticosteroid use. If the cause of Cushing syndrome is long-term use of corticosteroid medication, your doctor may be able to keep your Cushing syndrome signs and symptoms under control by reducing the dosage of the drug over a period of time, while still managing the condition for which you take it. Do not reduce the dose of corticosteroid drugs or stop taking them on your own. Do so only under your doctor's supervision. Abruptly discontinuing these medications could lead to deficient cortisol levels. So slowly tapering off corticosteroid drugs allows your body to resume normal cortisol production. Surgery. If the cause of Cushing syndrome is a tumor, your doctor may recommend complete surgical removal. Pituitary tumors are typically removed by a neurosurgeon who may perform the procedure through your nose. For a tumor in the adrenal glands, lungs, or pancreas, the surgeon can remove it through a standard operation or by using minimally invasive surgical techniques with smaller incisions. After the operation, you will need to take cortisol replacement medication to provide your body with the correct amount of cortisol. In most cases, you will eventually return to normal adrenal hormone production, and your doctor can taper off the replacement drugs. Your endocrinologist will use blood tests to help determine if you need cortisol replacement and when it may be stopped. However, this process can take up to a year or longer. In some instances, people with Cushing syndrome never return to normal adrenal function. They then need lifelong replacement therapy. Radiation therapy. If the surgeon cannot totally remove a pituitary tumor, he or she will usually prescribe radiation therapy as well as surgery. Additionally, radiation may be used for people who are not suitable candidates for surgery. Radiation can be given in small doses over a 6 weeks period or with a technique called stereotactic radiosurgery. In the latter procedure, a larger one-time dose of radiation is delivered to the tumor, and the radiation exposure to surrounding tissue is minimized. Medication. Medication can be used to control cortisol production when surgery and radiation do not work. Medication might also be used before surgery in people who have become very sick with Cushing syndrome to improve signs and symptoms and minimize surgical risk. Medical therapy may not completely medical therapy may not completely improve all of the symptoms of excess cortisol. Medication to control excess production of cortisol at the adrenal glands include ketoconazole, mitotane, that comes with the name of lysodren, and metarapone, that is metopirone. Mifepristone, that comes with the name of Mifeprex, is approved for people with Cushing syndrome who have type 2 diabetes or glucose intolerance. Mifepristone does not decrease cortisol production, but it blocks the effect of cortisol on your tissues. Side effects from these medications may include fatigue, nausea, vomiting, headaches, muscle aches, high blood pressure, low potassium, and swelling. Some have more serious side effects such as neurological side effects and liver toxicity. Newer medication for Cushing syndrome include pasireotide, that comes with the name of Signifor, given as a twice daily injection, and osilodrostat, that comes with the name of Isturiza, that is a pill. Other medications are being developed. In some cases, the tumor or its treatment will cause the pituitary or adrenal gland to produce not enough of the other hormones, and your doctor will recommend hormone replacement medication. If none of these treatment options is appropriate or effective, your doctor may recommend surgical removal of your adrenal gland, that is bilateral adrenalectomy. This procedure will cure excess production of cortisol but will require lifelong replacement medications. Well, now I'll tell you some lifestyle and home remedies. And during a recovery period, the length of your recovery from Cushing syndrome will depend on the severity and cause of your condition. You do not develop Cushing syndrome overnight, and your symptoms won't disappear overnight either. In the meantime, the tips which I'm going to tell you may help you or your journey back to health. The first tip is increase activity slowly. Work up to a reasonable level of exercise or activity that feels comfortable without overdoing it. You will improve little by little, and your persistence will be rewarded. Eat sensibly. Nutritious foods provide a good source of fuel for your recovering body and can help you lose pounds you gained from Cushing syndrome. Make sure you are getting enough calcium and vitamin D. Taken together, they help your body absorb calcium, which can help strengthen your bones, counteracting the bone density loss that often occurs with Cushing syndrome. Monitor your mental health. Depression can be a side effect of Cushing syndrome, but it can also persist or develop after treatment begins. Do not ignore your depression or wait it out. Seek help promptly from your doctor or a therapist if you are depressed, overwhelmed, or having difficulty coping during your recovery. Gently soothe aches and pain. Hard pulse, massages, and low-impact exercises such as water aerobics and Tai Chi can help alleviate some of the muscle and joint pain that accompanies Cushing syndrome recovery. Well, this was my video about Cushing syndrome. I hope you like this video. If you have any question about Cushing syndrome, or if you want me to upload a video about any illness that for that video is already not there, you can post your comment in the comment section, and as soon as I get time, I'll try to upload a video about that particular illness. Thanks for watching this video. See you in next video. Bye for now.